As people age, maintaining proper nutrition becomes increasingly important for overall health and well-being. Magnesium is a vital mineral that supports many bodily functions, including muscle and nerve function, bone health, and energy production. For adults over 60, magnesium supplements are often recommended to help meet daily requirements. But what happens if someone in this age group stops taking magnesium supplements? Understanding the potential effects of discontinuing magnesium is crucial, as it can impact various aspects of health and quality of life for older adults. When magnesium is suddenly discontinued, the body can react almost immediately. Some individuals may notice muscle cramps, fatigue, or headaches within just a few days. These symptoms can appear quickly because magnesium plays a crucial role in nerve and muscle function. Without it, the body struggles to maintain balance, leading to noticeable discomfort in a short period of time. Many people believe that taking magnesium supplements can cause the body to become dependent on them, but this is a misconception. The body does not develop a physical dependency on magnesium supplementation, as it naturally regulates magnesium levels through absorption and excretion. If supplementation is stopped, the body simply returns to relying on dietary sources without experiencing withdrawal or adverse effects. It's important to note that magnesium is an essential mineral, and maintaining adequate levels is best achieved through a balanced diet whenever possible. Magnesium plays a crucial role in muscle function and nerve signaling throughout the body. It helps regulate the contraction and relaxation of muscles, ensuring smooth and coordinated movements. In the nervous system, magnesium supports the transmission of signals between nerve cells, which is essential for proper communication and response. When magnesium supplementation is stopped, the body may experience a deficiency, potentially leading to muscle cramps, weakness, or abnormal nerve activity. Maintaining adequate magnesium levels is important for both muscular health and efficient nerve function. Withdrawal symptoms and magnesium deficiency can sometimes present with similar signs, but they have distinct causes and implications. Withdrawal symptoms typically occur when the body is adjusting to the absence of a substance it has become dependent on, such as certain medications or alcohol. In contrast, magnesium deficiency results from inadequate levels of magnesium in the body, which can lead to muscle cramps, fatigue, and irregular heart rhythms. Older adults should be aware that age-related changes can increase the risk of both conditions, making it important to consult healthcare providers for proper diagnosis and management. Understanding these differences can help ensure appropriate treatment and support overall well-being. Magnesium deficiency can manifest through a variety of symptoms, some of which may become more noticeable after discontinuing supplementation. Common signs include muscle cramps, persistent fatigue, and irregular heart rhythms. These symptoms occur because magnesium plays a crucial role in muscle and nerve function, as well as maintaining a steady heartbeat. If you stop taking magnesium supplements, your body may quickly reveal these deficiencies, especially if your dietary intake is insufficient. Recognizing these early warning signs can help prompt timely adjustments to your nutrition or supplementation routine. As we age, our bodies undergo several changes that can affect how we absorb and metabolize nutrients like magnesium. The efficiency of the digestive system often declines, leading to reduced absorption of magnesium from food. Additionally, the kidneys may become less effective at retaining magnesium, increasing the risk of deficiency. For individuals over 60, discontinuing magnesium supplements can further lower magnesium levels, potentially impacting muscle function, bone health, and overall well-being. Understanding these age-related changes is important for maintaining adequate magnesium status in later life. Scientific research has explored the impact of magnesium supplementation in seniors, focusing on areas such as muscle function, bone health, and cognitive performance. Many studies suggest that regular magnesium intake can support overall well-being in older adults, potentially reducing the risk of certain age-related conditions. However, evidence also indicates that discontinuing magnesium supplements may lead to a gradual decline in these benefits. Some studies report that markers of magnesium status and related health improvements can diminish after stopping supplementation. This highlights the importance of consistent intake for maintaining the positive effects observed during supplementation. Magnesium plays a vital role in maintaining cardiovascular health. It helps regulate heart rhythm, supports healthy blood pressure levels, and contributes to the proper functioning of blood vessels. When magnesium intake is insufficient, the risk of developing high blood pressure, irregular heartbeats, and other heart-related issues may increase. Ensuring adequate magnesium levels is therefore important for reducing the likelihood of cardiovascular complications and supporting overall heart function. Magnesium plays a crucial role in maintaining bone health, especially in older adults. When magnesium supplementation is discontinued, there may be a gradual decline in bone mineral density, increasing the risk of osteoporosis over time. This is because magnesium helps regulate calcium absorption and bone formation. Without adequate magnesium, bones can become more fragile and susceptible to fractures. Therefore, consistent magnesium intake is important for supporting skeletal strength and reducing osteoporosis risk in aging populations. After discontinuing magnesium, some individuals may notice neurological changes. These can include shifts in mood, such as increased irritability or feelings of anxiety. Sleep quality might also be affected, with some people experiencing difficulty falling or staying asleep. Additionally, cognitive functions like memory and concentration could become less sharp. These effects vary from person to person, depending on individual health and dietary factors. When considering stopping magnesium supplementation, it's important to do so gradually rather than abruptly. Slowly reducing your daily dose allows your body to adjust and helps prevent any sudden changes in magnesium levels. During this process, pay close attention to how you feel, watching for symptoms such as muscle cramps, fatigue, or irregular heartbeat, which could indicate a deficiency. If you notice any concerning signs, consult with a healthcare professional for guidance. This careful approach supports your overall well-being while discontinuing supplementation. Magnesium is found naturally in a variety of foods, making it possible to meet your daily needs through a balanced diet. Leafy green vegetables like spinach, nuts such as almonds and cashews, and whole grains are all excellent sources. Beans, seeds, and even dark chocolate can also contribute to your magnesium intake. By including these foods regularly in your meals, you can help maintain healthy magnesium levels without relying on supplements. Remember, a diverse diet not only supports magnesium intake, but also promotes overall well-being. Before adjusting your magnesium intake, it's important to consult a healthcare provider, particularly if you have underlying health conditions. Certain medical issues, such as kidney disease or heart disorders, can affect how your body processes magnesium. Additionally, some medications may interact with magnesium supplements, leading to unwanted side effects. A healthcare professional can help determine the appropriate dosage and ensure that any changes are safe for your individual needs. In summary, stopping magnesium supplementation is typically not considered dangerous for most people. However, abruptly discontinuing magnesium can sometimes lead to issues, particularly among older adults. Seniors may be more susceptible to negative effects due to changes in their body's ability to regulate minerals. It's important to be aware of these potential risks and consult a healthcare provider if you have concerns about stopping magnesium. As we age, making informed decisions about our health becomes increasingly important. Adjusting supplement routines after the age of 60 should always be guided by reliable information and professional advice. Regular health monitoring helps ensure that any changes are both safe and effective. By staying proactive and well-informed, individuals can better support their overall well-being throughout the later stages of life. Understanding magnesium. Interactions with other nutrients. Magnesium doesn't work in isolation within the body. It has important relationships with other essential nutrients, particularly calcium, vitamin D, and potassium. These nutrients work together synergistically, meaning the presence and balance of one affects how well the others function. When magnesium supplementation is discontinued, this delicate balance can be disrupted. For instance, Magnesium helps the body properly utilize vitamin D, which in turn affects calcium absorption. Without adequate magnesium, even if you're taking calcium and vitamin D supplements, your body may struggle to use them effectively. This interconnected relationship is especially important for seniors, as they often take multiple supplements for bone health and cardiovascular support. Different forms of magnesium and their implications. Not all magnesium supplements are created equal, and the form of magnesium you've been taking can influence what happens when you stop. Magnesium citrate, magnesium glycinate, magnesium oxide, and magnesium chloride each have different absorption rates and bioavailability. If you've been taking a highly absorbable form like magnesium glycinate, your body may have been receiving more substantial support than someone taking magnesium oxide, which has lower bioavailability. Consequently, discontinuing a highly absorbable form might result in more noticeable changes. Understanding which form you've been using can help you and your healthcare provider make better decisions about dietary compensation or alternative supplementation strategies. Special considerations for specific health conditions. Certain health conditions make the decision to stop magnesium supplementation more complex. Individuals with type 2 diabetes often benefit from magnesium supplementation, as studies have shown it can help improve insulin sensitivity and blood sugar control. Discontinuing magnesium in this population might affect glycemic management. Similarly, those with chronic migraines have found relief through regular magnesium supplementation. Stopping suddenly could potentially lead to an increase in migraine frequency or intensity. People with digestive disorders, such as Crohn's disease or celiac disease, already face challenges absorbing nutrients properly, making them particularly vulnerable to deficiency when supplementation stops. These special populations require extra careful monitoring and individualized approaches when considering any changes to their magnesium intake. The role of medications in magnesium. Status. Many commonly prescribed medications can affect magnesium levels in the body, a factor that becomes even more significant when supplementation is discontinued. Diuretics, often prescribed for high blood pressure or heart failure, can increase magnesium excretion through urine. Proton pump inhibitors, widely used for acid reflux and stomach ulcers, may reduce magnesium absorption over time. Antibiotics in the fluoroquinolone family can also interfere with magnesium levels. For seniors taking one or more of these medications, stopping magnesium supplements could compound the depletion effect, potentially leading to more pronounced deficiency symptoms. It's essential to review your complete medication list with your healthcare provider when considering changes to magnesium supplementation, as adjustments to either medications or supplements may be necessary to maintain optimal health. Testing and monitoring magnesium levels. While it might seem straightforward to simply test magnesium levels in the blood, the reality is more complex. Standard serum magnesium tests only measure the magnesium circulating in your bloodstream, which represents less than 1% of your body's total magnesium stores. Most magnesium is found within cells and bones, making true deficiency difficult to detect through routine blood work. Some healthcare providers may recommend additional testing methods, such as red blood cell magnesium tests or ionized magnesium measurements, which can provide a more accurate picture of your magnesium status. If you're considering discontinuing supplements, baseline testing before stopping, followed by periodic monitoring, can help track any changes and guide decisions about whether dietary sources alone are sufficient for your needs. Lifestyle factors that affect magnesium requirements. Beyond age and health conditions, several lifestyle factors can influence how much magnesium your body needs and how quickly deficiency might develop after stopping supplements. Regular physical activity, while beneficial for overall health, increases magnesium requirements due to its role in energy production and muscle function. Active seniors who suddenly stop magnesium supplementation while maintaining their exercise routines might notice muscle soreness or cramping more quickly. Chronic stress is another factor that can deplete magnesium stores, as the mineral plays a role in the body's stress response system. Additionally, alcohol consumption can interfere with magnesium absorption and increase urinary excretion. Seniors who enjoy moderate alcohol consumption should be particularly mindful of maintaining adequate magnesium intake through diet if they choose to discontinue supplements. Common mistakes when discontinuing magnesium. One of the most frequent errors people make when stopping magnesium supplementation is failing to compensate through dietary changes. Simply stopping the supplement without consciously increasing magnesium-rich foods in your diet can leave a significant gap. Another common mistake is discontinuing all supplements simultaneously during a health scare or in an attempt to simplify medication regimens. While the desire to reduce pill burden is understandable, stopping multiple supplements at once makes it difficult to identify which changes might be affecting your health. Some individuals also make the error of restarting supplementation at their previous high dose after experiencing deficiency symptoms, rather than gradually reintroducing it. This approach can sometimes cause digestive discomfort, particularly with certain forms of magnesium. Long-term outlook and prevention strategies. Looking ahead, maintaining adequate magnesium status throughout aging requires a proactive approach. Even if you successfully transition away from supplements, regular dietary assessment and periodic health monitoring remain important. As the body continues to age beyond 60, absorption efficiency may decline further, potentially necessitating a return to supplementation in the future. Prevention strategies include diversifying your diet to include multiple magnesium sources, staying well hydrated to support mineral balance, managing stress through appropriate techniques, and maintaining regular communication with your healthcare team. Some seniors find that seasonal adjustments work well. For example, taking supplements during winter months when fresh produce consumption might decrease, while relying more on dietary sources during summer when fruits and vegetables are more abundant and varied. The importance of individualized approaches. Perhaps the most critical point to understand is that there is no one-size-fits-all answer to whether stopping magnesium supplementation is appropriate. Your unique combination of health status, medications, diet, activity level, and genetic factors all influence your magnesium needs. What works well for one person may not be suitable for another. Some seniors may thrive on dietary magnesium alone, while others may need ongoing supplementation despite their best dietary efforts. The key is working closely with healthcare providers to develop a personalized plan that considers all aspects of your health and lifestyle. Regular reassessment ensures that your approach continues to meet your changing needs as you age.